I want to talk to you today about something that's very easy to mistake for asthma, a chest problem, or a lingering chesty cough. Yet, that can be one of the ways the heart signals it's struggling, a cough or a wheeze that's worse at night, or when you lie down, and why this particular timing can point to the heart rather than the lungs. Because a wheeze or a nighttime cough naturally makes us think of the chest and the lungs, asthma, bronchitis, or an infection, and rarely the heart. Yet when the heart struggles and fluid congests the lungs, it can cause exactly this, a cough and even a wheeze that worsen on lying down, so much so that doctors have a name for the heart, causing wheeze. So, understanding when a cough or wheeze might be the heart is genuinely worthwhile. So, today I want to explain why the heart can cause a cough and wheeze, why lying down and nighttime matter as clues, how it fits with the other positional breathing signs, how to tell it from respiratory causes when it matters, and what to do in partnership with your doctor. And I'll keep this calm and balanced because while most coughs and wheezes are respiratory, some can be the heart, and understanding the difference lets you respond wisely in partnership with your doctor. This is about recognizing an easily mistaken but sometimes important sign. Let me start with why the heart can cause a cough and wheeze, because the mechanism makes sense of it. Here's how the heart can cause a cough and even a wheeze. As I've discussed, when the heart doesn't pump efficiently in heart failure, fluid backs up and congests the lungs. This fluid in and around the small airways and air spaces of the lungs does two things. It irritates the airways, provoking a cough, often dry, which I discussed under a persistent cough, and it can cause the airways to narrow and the congested lungs to produce a wheeze, a whistling sound on breathing, which can genuinely mimic the wheeze of asthma. In fact, this heart-caused wheeze is recognized enough that doctors have historically called it cardiac asthma, meaning wheeze and breathlessness caused not by asthma, but by the heart, by fluid congesting the lungs. So, the heart can cause a cough and a wheeze because fluid congesting the lungs in heart failure irritates the airways and narrows them, producing a cough and a wheeze that can mimic asthma. So, understanding that lung congestion from heart failure can cause cough and wheeze is the foundation. So the heart can cause cough and wheeze via lung congestion. So heart failure can mimic a chest problem. Let me explain why lying down and nighttime matter as clues, because it's the key insight. The timing, worse at night or lying down, is a genuinely useful clue pointing toward the heart, and here's why. Echoing what I've discussed about positional breathlessness. When you lie down flat, fluid that pooled in your legs during the day is reabsorbed and returns to the circulation, and redistributes toward your chest and lungs, increasing the congestion there in someone whose heart is struggling. So a heart-related cough or wheeze characteristically worsens when you lie down, and at night, often coming on an hour or two into sleep, and eases when you sit up because sitting up relieves the lung congestion. This positional pattern, worse lying down, better sitting up, is uncharacteristic of many respiratory coughs and is a hallmark of the heart-related kind, closely related to the breathlessness lying flat and waking breathless at night I've discussed. So, a cough or wheeze that's worse lying down and at night, and eases on sitting up, points toward the heart, because lying flat increases the lung congestion. So, the lying down and nighttime worsening, easing on sitting up, is the key clue pointing toward the heart, since lying flat increases lung congestion. So, the positional timing is the key clue. So, worse lying down, better sitting up points to the heart. Let me explain how it fits with the other positional breathing signs, because the family coheres. This cough and wheeze belong to the coherent family of positional and fluid signs of heart failure I've discussed, and seeing them together makes sense of it. Breathlessness lying flat, needing to prop up on pillows, waking suddenly breathless at night, breathlessness on bending, and now a cough or wheeze worse lying down and at night, all share the same cause. Lying down, or fluid overload, increasing the congestion in the lungs, and these go alongside the other congestion signs, ankle swelling, fatigue, breathlessness on exertion, and rapid weight gain. So, a heart-related nighttime cough or wheeze rarely comes alone. It typically appears amid these other signs, which is exactly what points toward the heart rather than the chest. So, if you have a cough or wheeze worse lying down, it's worth noticing whether you also get breathless lying flat or on exertion, wake breathless, or have swollen ankles, since together they build the picture. So, a heart-related cough or wheeze belongs with breathlessness lying flat, waking breathless at night, breathlessness on bending, ankle swelling, and fatigue, all reflecting lung congestion and fluid overload, typically appearing together. So, it's one of a coherent family of heart failure signs, so it usually appears amid the other congestion signs. Let me help you tell it from respiratory causes, because that's the practical heart of this. While you can't reliably tell yourself, some features help suggest when a cough or wheeze might be the heart rather than the lungs. More likely, the heart, worse lying down and at night, easing on sitting up, accompanied by the other heart failure signs, breathlessness on exertion or lying flat, waking breathless, ankle swelling, fatigue, or rapid weight gain, a dry cough or a wheeze without a clear respiratory illness, and in someone with heart risk factors or known heart disease, more likely respiratory, associated with a cold, chest infection, or other respiratory symptoms like fever, a runny nose, or colored phlegm, related to known asthma or COPD with their usual patterns and triggers, a wheeze with a clear history of asthma or lung disease, or a cough productive of colored phlegm suggesting infection. Crucially, the two can coexist and genuinely mimic each other, especially heart failure mimicking asthma, so you can't be sure yourself, which is why a cough or wheeze that's worse lying down, or comes with heart failure signs, warrants proper assessment. So, a cough or wheeze worse lying down and at night with other heart failure signs suggests the heart, while one with a respiratory illness or known lung disease suggests the lungs, though they overlap and need assessment. So the positional timing and accompanying signs distinguish the heart-related kind. So read a cough or wheeze by its timing and company. So timing and company distinguish heart from lungs. Let me stress the importance of proper assessment because misattribution runs both ways. Let me stress why proper assessment matters here, because getting it wrong runs both ways and both are consequential. If heart failure causing a wheeze is mistaken for asthma, the person may be treated with asthma inhalers that don't address the real problem while the heart failure goes untreated, which is genuinely harmful. Conversely, a true respiratory condition mustn't be assumed to be the heart either. And in older adults, heart and lung conditions often coexist, making it genuinely difficult to untangle, which is precisely a job for proper medical assessment with examination and tests. So, rather than assuming a nighttime cough or wheeze is asthma or a chest problem or the heart, getting it properly assessed ensures the real cause or causes are identified and treated. So, a nighttime cough or wheeze warrants proper assessment because heart failure mimicking asthma can be mistreated with inhalers while the heart goes untreated, and heart and lung conditions often coexist, so a proper assessment identifies the real cause. So, proper assessment prevents dangerous misattribution, so get it properly assessed rather than assuming. Let me note the general reasons to check a persistent cough or new wheeze, because they matter too. Beyond the heart, a persistent cough or a new wheeze warrants seeing your doctor for other reasons too, which I've touched on. A persistent cough lasting weeks warrants checking since, especially in older adults, smokers, or former smokers, it can occasionally signal a serious lung problem worth catching early, as well as other causes. And a new wheeze, or new breathlessness, warrants assessment to diagnose its cause, whether heart, asthma, COPD, or other. So a persistent cough or new wheeze should be assessed regardless, both for the heart and for these other reasons. So a persistent cough or new wheeze warrants checking regardless, since it can signal lung or other conditions worth catching early, especially in older adults and smokers beyond the heart. So persistent cough or new wheeze warrants checking for many reasons. So get a persistent cough or new wheeze checked. Let me be very clear about the emergency version, because severe cases are urgent. Crucially, while the gradual cough or wheeze I've mainly discussed warrants seeing your doctor, a severe version is an emergency. Seek emergency attention, calling emergency services for sudden severe breathlessness with wheeze, a wheeze or cough with severe breathlessness, chest pain, bluish lips, or severe distress, or coughing up frothy or pink-tinged phlegm with severe breathlessness, which, as I've discussed, can signal acute severe heart failure with the lungs flooding, a dire emergency, and which can come with a wheeze. Equally, a severe asthma or lung attack with severe breathlessness is an emergency, so treat severe breathlessness with wheeze or cough, especially with chest pain, bluish lips, or frothy pink phlegm, as an emergency and call emergency services immediately. So, severe breathlessness with wheeze or cough, especially with chest pain, bluish lips, or frothy pink phlegm, is a medical emergency. So, severe cases are urgent. So, call emergency services for severe breathlessness with wheeze. Let me be clear about what to do, because the response should match the situation. So here's what to do. For severe breathlessness with wheeze or cough, especially with chest pain, bluish lips, or frothy or pink-tinged phlegm, call emergency services immediately. For a cough or wheeze that's worse lying down or at night, eases on sitting up, or comes with other heart failure signs like breathlessness on exertion or lying flat, waking breathless, ankle swelling, fatigue, or rapid weight gain, see your doctor to check for heart failure as well as respiratory causes, describing specifically the positional timing. For a persistent cough lasting weeks or a new wheeze, see your doctor regardless to check for lung and other causes. If you have known heart failure and develop a nighttime cough or wheeze, mention it, as it can signal worsening fluid, following your monitoring guidance without adjusting medications yourself. And if you have known asthma or COPD, follow your management plan, but see your doctor if it changes, or a new positional pattern appears. So call emergency services for severe cases. See your doctor for a positional or heart failure associated cough or wheeze, and for any persistent cough or new wheeze, and follow your plans without stopping medications. So match your response to the situation. So respond per the situation, urgently when severe. Let me paint you a quick picture of how this helps. Picture a man in his 70s who's developed a nighttime cough and a wheeze, worse when he lies down, better when he sits up, which he and even others have assumed is asthma or a chesty problem, so he's been trying an old inhaler without much help. Meanwhile, his ankles have been swelling, he's breathless on the stairs, and he's needed an extra pillow, unconnected in his mind. Understanding that a cough or wheeze worse lying down, easing on sitting up, especially with these other signs, can be the heart congesting the lungs, not asthma. He sees his doctor and describes the positional pattern and the other signs. His doctor recognizes possible cardiac asthma, assesses him, finds heart failure, and treats it. And as the fluid overload resolves, his nighttime cough and wheeze settle, he can lie flat, and his ankles and breathlessness improve, achieving what the inhaler never could. The same man, but recognizing his positional cough and wheeze as possibly the heart rather than assuming asthma, got heart failure caught and properly treated. That contrast is exactly why understanding this easily mistaken sign matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that a cough or wheeze that's worse at night, or lying down and eases on sitting up, can be the heart congesting the lungs, sometimes called cardiac asthma, rather than a chest problem, especially when it comes with other heart failure signs like breathlessness on exertion or lying flat, waking breathless, ankle swelling, fatigue, or rapid weight gain. You can help by noticing this positional pattern and the other signs, and encouraging a loved one to see the doctor for proper assessment, rather than assuming asthma or a chesty cough, since treating it as asthma with inhalers won't help if it's the heart. Encourage checking any persistent cough or new wheeze regardless. If they have known heart failure and develop a nighttime cough or wheeze, encourage mentioning it and following their plan without adjusting medications. Crucially, seek emergency care for severe breathlessness with wheeze, chest pain, bluish lips, or frothy pink phlegm. Helping a loved one get a positional cough or wheeze properly assessed can catch heart failure that inhalers would never fix. So, let me draw this all together. A cough or wheeze that's worse at night or when you lie down can be the heart, not the lungs. Because when the heart struggles in heart failure, fluid congests the lungs, irritating and narrowing the airways to cause a cough and even a wheeze that can mimic asthma, recognized enough to be called cardiac asthma. The key clue is the positional timing, worse lying down and at night, easing on sitting up, because lying flat increases the lung congestion, which places it in the same family as breathlessness lying flat and waking breathless at night. A cough or wheeze worse lying down, with other heart failure signs, suggests the heart, while one with a respiratory illness or known lung disease suggests the lungs, though they overlap, coexist, and genuinely mimic each other. So proper assessment matters, since treating heart failure as asthma with inhalers won't help. And a persistent cough or new wheeze warrants checking regardless. So call emergency services for severe breathlessness with wheeze, chest pain, bluish lips, or frothy pink phlegm. See your doctor for a positional or heart failure associated cough or wheeze, and for any persistent cough or new wheeze, and follow your plans without stopping medications. So, here's what I'll leave you with, straight and clear. First, understand that the heart can cause a cough and a wheeze, because fluid congesting the lungs in heart failure irritates and narrows the airways, producing a cough, often dry, and a wheeze that can genuinely mimic asthma, historically called cardiac asthma. Second, know the key clue. A heart-related cough or wheeze characteristically worsens when you lie down and at night, often an hour or two into sleep, and eases when you sit up, because lying flat increases the lung congestion, unlike many respiratory coughs. Third, see how it fits. It belongs to the coherent family of positional and fluid signs of heart failure, with breathlessness lying flat, waking breathless at night, breathlessness on bending, ankle swelling, fatigue, and rapid weight gain, typically appearing together. Fourth, distinguish it. A cough or wheeze worse lying down and at night, easing on sitting up. With other heart failure signs suggests the heart, while one with a respiratory illness, colored phlegm, or known asthma or COPD suggests the lungs, though they overlap, coexist, and mimic each other. So proper assessment matters, since mistaking heart failure for asthma means inhalers won't help, while the heart goes untreated and a persistent cough or new wheeze warrants checking regardless, especially in older adults and smokers. And fifth, crucially, treat severe breathlessness with wheeze or cough, especially with chest pain, bluish lips, or frothy or pink-tinged phlegm, as a medical emergency and call emergency services immediately, while seeing your doctor for a cough or wheeze that's worse lying down, or comes with heart failure signs and for any persistent cough or new wheeze. Describing the positional timing, mentioning a new nighttime cough or wheeze if you have heart failure, and following your plan without adjusting medications, and following your asthma or COPD plan while seeing your doctor if the pattern changes. A cough or wheeze worse at night or lying down is easily mistaken for asthma or a chest problem, but can be the heart. So recognizing the positional clue and getting it properly assessed can catch heart failure that inhalers would never fix, which is well worth doing. So take care of yourself. Notice a cough or wheeze that's worse lying down, describe the timing to your doctor, and act urgently on severe breathlessness with wheeze. And because a cough or wheeze worse lying down and at night can be the heart congesting the lungs rather than asthma, please treat a cough or wheeze that's worse lying down or comes with heart failure signs, and any persistent cough or new wheeze as your reason to see your own physician for proper assessment, and treat severe breathlessness with wheeze, chest pain, bluish lips, or frothy pink phlegm as your reason to call emergency services immediately. This touches on a cough, wheeze, and breathlessness, which can be worrying. So, if a nighttime cough or wheeze is troubling you, please know it's worth proper assessment, and your doctor can find the cause and help.